couple years ago, we started talking about the retailization of healthcare. Why did we use that term? Each and every one of us, here, we're consumers of something. And whatever that happens to be at the moment, you're making your own value proposition about where you choose to go. It may be based on convenience, price, service. You're defining your value proposition.
Part of our work ultimately is in the empowerment of the people who are actually paying us for the things that we do, but done in a way that the incentives are aligned for the right behaviors and outcomes that we need to do.
Berthelius, and I admire what Bernard has done at Kaiser, because I think he has created the framework for a solution in that, he is centering healthcare around, the patient. And I'll give you an example of, something that we're in the process of rolling out, because there's been so much rhetoric and discussion about drug pricing. But yet, think about that physician. When he or she is writing that prescription, that doc has no idea the out-of-pocket cost of that medication for their patient. So we're in the process of embedding, that patient's plan design, in the patient's EHR. So when the physician goes and, puts that prescription in, he or she will be able to see the patient's out-of-pocket costs and up to 5 alternatives and the cost associated with each. One of the things that we're seeing is physicians are switching to a lower cost alternative 30% of the time, with an average savings to the patient of $70. Yeah. And I think, Bernard, that's a great example of what you're talking about.
Yeah, absolutely. But what we did was we trained our patients generally that you had to come to us for everything. Well, now with technology and everything, we're demonstrating that no, you don't have to come in for everything. I'm connected. I can email what you need. I can
And you do more than half
messaging
of your interactions digitally.
Yeah.
Because frankly, a lot of us are too busy to have to even call. I've become like the kids. Text me.
I think we have to look at modern tools and techniques that gets the attention of very busy people who are listening to a lot of noise every single day. And we have to step out of our internal stats that we love to talk about. We got to figure out how to make all of that relevant and cool to the 21st century.